In this film, the application of a dorsal forearm splint will be demonstrated. In this case, the patient is presenting with a simulated distal radius fracture, with the distal part being slightly angulated to the dorsal side. Reduction may be required depending on the extent of displacement of the fracture. Reduction is, however, not demonstrated in this film. Before starting the application, the arm is examined. The sensation in the thumb and other digits is examined, and the capillary refill is assessed. Injuries to the wrist may be accompanied by elbow injuries. The ulna and the head of the radius are palpated to test for tenderness. All these examinations are used to detect abnormalities, so they can be acted on if necessary. Also, the results can be compared to the physical examination after the splint has been applied. The following materials are required to apply a dorsal forearm splint: one small stockinette with a width of 2.5 centimeters, a stockinette with a width of 5 centimeters, padding with a width of 7.5 centimeters, plaster. For an average size adult, 8 to 10 layers should be sufficient, an elastic wrap with a width of 7.5 centimeters, medical tape, and bandage scissors. Do note that the size of the materials used depends on the size of the patient. The small stockinette is placed over the thumb. The length of the stockinette to be applied over the forearm is now measured. The stockinette should be long enough to cover the entire forearm and include the hand. A hole should be created through which the thumb is placed. The location is decided using the patient's base of the thumb as a landmark, and a small cut is made at that point. The stockinette is rolled up to prevent sliding pressure on the affected limb, and it is gently passed over the entire hand and entire forearm of the patient. Any wrinkles are removed. Note that the stockinette is wrinkle-free, as wrinkling may cause irritation of the skin. Next, the padding needs to be applied. Care should be taken to apply extra padding over the ulnar prominence to avoid pressure complications. Excessive padding should be avoided, as this may cause the splint to be too loose and be able to move over the arm, which may lead to scratches or blisters. Care should be taken to ensure that the stockinette can be folded back once the plaster is applied to expose the metacarpophalangeal joints, as these joints should not be immobilized. The flat part of the roll should be applied onto the limb, allowing for easy unrolling. The application is started by encircling the wrist joint twice, making sure to include the ulnar prominence. It is then placed through the first web space, over the wrist, and again through the first web space. The padding is unrolled further proximally until the entire forearm is covered. Note that each turn of padding overlaps the preceding one by approximately 50%. Note that the stockinette is left longer than the padding proximally and distally. This allows folding of the stockinette and protecting the skin from sharp edges once the splint is applied. It is advised to check if there are no uncovered areas left. This should be avoided to limit the risk of thermal injury of the skin. How the plaster will be applied while dry is demonstrated. Note that the plaster is adjusted so that it fits around the thumb. Proximal to the thumb, extra space is created in the plaster so the thumb can be extended. The plaster should be applied 2 finger breadths from the elbow crease, along the dorsal side of the arm and wrist joint. In this view, the different layers of the splint are clearly visible. Water at room temperature is used, as too hot water causes the plaster to harden too quickly. The plaster is folded in a corrugated fashion, as now shown, and then dipped in the water for a few seconds. Excess water is now squeezed from the plaster, and it is then applied over the dorsal side of the forearm. It is formed in the curved shape, so it fits nicely around the forearm. Thereafter, the plaster is smoothened over the forearm to remove any wrinkles and to distribute the water evenly throughout it, with care taken to ensure no skin comes in contact with the plaster. Note that the plaster extends beyond the padding proximally. Therefore, the plaster is trimmed. The longer stockinette and padding are now folded over the plaster, creating smooth edges. Take note how this is done distally, exposing the metacarpophalangeal joints. Also note how the stockinette is folded back over the thumb. Thereafter, the elastic wrap is applied to the limb with the flat part against the surface of the plaster and rolled in the same direction as the padding was previously. After the wrist is encircled twice, the wrap is cut and the uncut part is placed in the first web space. The wrist is again encircled and the wrap is again cut. The elastic wrap is applied to the entire length of the forearm, as shown. Although application of the elastic wrap is done under tension, care is taken not to put too much tension on it, as this may compromise blood flow to the digits. The plaster is moulded as if the patient has presented with a distal radius fracture with the distal part of the radius angulated to the dorsal side. The wrist joint is flexed like this to restore the physiological position of the radius as much as possible. Also note that the wrist is deviated to the ulnar side, as this is the natural position of the wrist. This can also be done to prevent shortening of the radius. Note that one hand is placed on the volar side, just proximal to the fracture, while placing pressure on the radius in a dorsal direction. The other hand is placed on the dorsal side with a thumb distal to the fracture and the other digits further proximal to the fracture, thus providing a 1, 2, 3-point fixation of the fracture to mould the plaster in the correct position. The plaster is supported in this position until it is sufficiently hardened. To avoid points of pressure, care is taken to use the flat parts of the hand rather than the fingertips. Following the application of the splint, it is important to check if the metacarpophalangeal joints are exposed and the patient is able to flex these joints. On the volar side, the palmar crease should be exposed. The distance between the plaster and the elbow joint should be at least 2 finger breadths to allow bending when it is placed in a triangular bandage and to ensure that the plaster does not irritate the skin. Finally, the capillary refill is reassessed and compared to the initial findings. A triangular bandage is used to immobilize the affected arm. The longer side is placed over the shoulder of the unaffected arm, and the other side is placed over the shoulder of the affected arm. A reef knot is used to secure the bandage. A safety pin is then used to close the open end of the bandage, with care taken that the bandage supports the elbow. The application of the splint is now completed. Take note of the hand's elevated position in relation to the elbow. This prevents swelling of the hand and forearm. Be aware that a triangular bandage is preferred over a sling, as a sling carries the risk of causing pressure complications via indentations in the plaster.